Thank you for joining us. My name is Russell Hendrickson, and thank you for joining us for today's webinar, Managing Revenue Integrity with Analytics, Moving Beyond Billing and Collections. Joining me today is Becky Cook, who's an executive consultant with PDS and brings a significant amount of experience with managing revenue and revenue integrity, which is today's topic.
Thank you for the invitation, Russell.
So it's fairly easy today. With the dashboarding technology, we can build out dashboards, collect metrics, build charts, graphs, visualize things, whether we do them in what I like to call a static dashboard, which might look something like this, with different metrics blended with answers to questions on the screen. If we want to get a little more sophisticated with the technology, we can build out our visualizations in a web-based interactive visualization tool like the one that I'm showing here. The goal, obviously, is to communicate what's going on, and the topic today is about revenue integrity. And so, Becky, can you share with us what we're going to cover today? We're going to come back to both of these dashboards, but if you would, Becky, why don't you set us up with what we're going to talk about today?
Certainly. So revenue integrity is really something that if you're a CFO in a small practice, you've been doing for years. If you're working in a larger organization, as the organization gets bigger, many of the functions of revenue cycle and revenue integrity get divided into different departments. And so the position of revenue integrity manager has come about to help bring those separate areas back together again to get an integrated look at what are the revenue opportunities, gaps, and results within the organization. So a revenue integrity manager might be heavily involved in looking at denials, charge capture, collections at the point of service, and other areas like recognized revenues, as well as compliance issues. They need to be able to concisely communicate to the organization to justify their positions, and we want to make sure that they are able to positively contribute to the organization.
Excellent. So it's a revenue integrity, fairly broad area. We here at PDS, we like to break it down, thinking about revenue integrity in terms of pre-visit type metrics, metrics that happen at the point of service or shortly as part of the point of service, and then what might happen in the back office, what happens after we've processed the claim and where there are opportunities. So Becky, can you share some of the common revenue integrity metrics and break down these categories a little further for us?
Sure. So within pre-visit, you're really typically looking at things around registration. So registration percentage, pre-registration, making sure that benefits are verified so that you can collect at the point of service, confirming appointments, ABNs prepared, and providing financial counseling before patients even get to your office. Then point of service metrics are things around getting charges captured, getting your CPT code and diagnosis codes verified, getting copays collected, which is a big task now with high deductible plans. And then the back office is a huge category of dealing with your open appointments, making sure all your charges are in, looking at your claim edits, making sure they're cleared promptly, looking at payment and charge lags, looking at your denial rates and your denial recoveries, just a huge area. So there are just dozens of metrics that you can use that help support your revenue integrity functions.
So Becky, how do you determine, I mean, we've got a lot of different metrics here, and I know this is just sort of a tasting of what could be done. How do we determine what information you might want to include into a dashboard? Can we start with that sort of at a high level?
Sure. So I really start with what the organization needs. We look at what their goals are and what they think are their gaps and opportunities, and then we build the dashboard to suit that. So we may at times start with information from our employees or team members who have concerns about a particular area, or physicians who have particular topics that they want to look at. We look at what information is already available so that we can get something going quickly. And then we might look at changes in regulations or reimbursement programs such as MIPS or changes to the Medicare Advantage plan where we think that there may be revenue opportunities for the practice. So I take a really practical approach to trying to build the dashboard.
Let's take that first dashboard I showed. This is our quick answers. and look at kind of the extended analysis of that, if you want to break that down a little further.
Okay, so this is really a more in-depth dashboard that looks at some of the trends really behind the scenes, some things that may not be obvious. So credit balances is on here on the upper left panel. Credit balances, there was a new Medicare requirement that requires refunds within 60 days. And so we needed to put something in place to make sure that we were, in fact, refunding patients promptly, and especially refunds directly to patients. And we looked at edit management in the lower left-hand corner because we wanted to make sure that those edits, claims edits, were getting cleared promptly and finding where are most of our claims getting slowed down and how can we put new processes in place to prevent that. And then a huge area is looking at denials. And we looked here at denials by likely source because we wanted to see why are we getting so many denials, causing a number of appeals, as you can see there below in the center. This took some digging. It's not information that's readily available, but it's important information to look at.
So let's dig in a little further and break down how can we use analytics to manage revenue integrity, and sort of what are the key steps or key approach that you used in the past to help sort of drive organizations when they both focus on a problem and then think about how might we apply analytics and dashboards to address the challenges we're seeing or the opportunities we're seeing.
We usually start with a simple measure and verify the results. So we need to understand where we are before we can take any action or put any process improvements in place. So we try to measure, and if possible, we verify our results using either internal or external benchmarks. So verifying those results may be as simple as looking at what did we do last year, or what are we doing compared to a budget or where we expected to be. Benchmarking could also be external benchmarks, such as from MGMA or AMGA or one of the sources. Maybe a magazine article that quotes a statistic that you want to compare to. Secondly, we analyze and quantify, and then we communicate. But let's take a look at that first step and maybe an example.
That's where I was taking us next. So let's go back to that first page of the Revenue Integrity Quick Answers dashboard. Obviously, here we're trying to measure and verify results. So how do we use this dashboard? I mean, I can see very quickly in that quick answers section, I see 5 questions and I see 3 green checks and 2 red X's without even looking at what are we looking at. I see we're not hitting our clean claim rate and that we're not clearing our claim edits in less than 7 days, 95% of the time. So how do we use this? Can you explain this dashboard a little further that I showed initially and how we might dig into that with benchmarking?
Sure. So you notice that denial management, we're looking at the number of claims outstanding. So we're trying to look at what are gaps. So this is also an example of gaps. But let's look at the coding status over in the upper right graph, where we're measuring the use of code 99214. So this is a key CPT code when we're looking at office visits to make sure that physicians are not leaving revenues on the table as they are seeing their patients. We've talked about this in other PDS webinars. What I've done here is we've set an upper and lower control limit. We tell the physicians that we'd like to see their coding of 99214 between these 2 lines, the lower limit of 40% and the upper limit at 90%. What we see here is that our largest specialties that see office visits are below that 40%, family practice, geriatrics, internal medicine, peds. Those are areas of particular concern that I would want to drill through to the detail to find out, are those particular physicians, are those all of our physicians? How can we get the detail on this? Can you show us, Russell, how we get the detail?
So if our dashboards are set up appropriately, our analytics solution is designed from the, if you will, the bottom up, we can simply click Analyze or drill into our dashboard. Purposely, I'm just looking at those E&M coding levels. We could continue to filter in on a particular physician. You'll notice the data is changing in real time. I can then, if I want to, add or look at, a graphical representation of our coding curves. And I even have the ability just to highlight or focus right in and drill all the way down to the patients or the visits. So our analytics really supporting our goal of identifying the different, verifying where we're seeing what we're measuring and are those gaps real. Of course, we also, though, may want to publish something a little more polished out for the physicians. And so we may have a dashboard once we've designed or we've identified this as an area we need focus. And we may have a dashboard that looks something like this down at the physician level. And again, if we've designed our dashboard to communicate, which we'll talk about coming up here, very quickly, I can see right away 99214s and that I'm at yellow, I'm not green, I'm not red. Potentially I'm trending in the right direction. But can you explain a little bit more of what we have here on the page with this dashboard and why we might want to take an analytics, just the codes, but then present it in context with some other data?
Sure. So physicians don't necessarily see the need for why they need to code better, code appropriately. But in fact, it impacts their productivity. It impacts, to some extent, their patient satisfaction in terms of making sure that patients are being treated in a single visit for multiple problems if they have them, so that you're not churning patients through one problem at a time. And it's always a good idea to present information to physicians in a consolidated manner. So we could have given them just their coding distribution, but by adding productivity, adding their schedule fill rate, and their days charges not billed, as well as patient satisfaction, we really give them the metrics that they're most interested for in their practice, all on one sheet of paper. We've provided context with the red, yellow, green, very simple and easy for them to read.
Yeah, one of the things that I don't think is obvious in this dashboard, but I want to point out as you're looking at it, is the red, yellow, green that you just mentioned, Becky, is due to benchmarking. And it could be external benchmarks, as Becky mentioned, or internal benchmarks. So those yellow, red, or greens are based on our thresholds, our targets, our ranges. And although they're not showing on this dashboard, certainly they could be supporting information or comments within your dashboards. But we are using benchmarking here, which is where you're getting the colors. So I just want to share that they could be both internal or external benchmarks. So with that, we talked a little bit about and showed you a few examples of measuring and verifying results and using benchmarks. Becky, can you talk to the second step, which is how do we analyze or quantify, really identifying what is the gap, the opportunity, what's the cost or the revenue potential, and how can we use analytics and revenue integrity and tie those two together?
Okay, so this is really how you make an analytics system help you, is being able to get into the data in such a way that you can summarize it, stratify it, consolidate it, or break it apart in order to tell you what's going on in the organization. So specifically, we're looking for gaps and opportunities, and then we also want to quantify what are those opportunities. So if we could, let's take a look at a dashboard here. So this is a denials dashboard. At the top, you'll see that it is a trend of our denial rate. It's actually charges that are denied. So here we've quantified our opportunity of how do we recover all of these denials. We have denials by division. We have denials by payer in the middle of the screen. We have the denial rate down below in the lower left-hand corner. And then you'll notice we have the denial impact and likely source. So we want to look at where are the denials coming from and can we address them in a way that makes sense. So when I say can we address them, can we recover the funds? We want to focus our efforts on denials that we can actually recover our money.
So in this dashboard, and this is a two-page visualization around denials. I like to say this is what's going on, where are we seeing denials. And really the key focus area here is denials by division. So you can see what is the denial rate. You can see in endocrinology we have a fairly high denial rate versus over here in gastroenterology. But where the denial rate is lower here, we also have a lot of charges in these two divisions here, right? So the question though, as Becky pointed out, is where's the gap or opportunity? What's happening after we get a denial? Because as far as revenue integrity goes, we've done the work, and if we don't get paid, which is the very impact of an unresolved denial or a write-off here, we can be looking at not just hundreds of thousands of dollars, but even millions of dollars. So the second page of our dashboard is designed to help quantify visually what is the opportunity and where are those gaps and how do we quickly find them. So what you'll see here on the top of the screen is these payments and adjustments are now matched back to the denials. These are just on the denials. So this is our denial recovery by month. You'll see then by division, and we saw hematology was one of those two divisions that had a lot of charges. And then here again is the likely source. So if we want to, the analytics now makes it very easy to point and identify where we're having, let's say, registration denials, which clearly are the highest likely source, and we can see infectious disease. But there's a few key things that we can do to quantify. Now, this chart here right in the middle shows the denied charges. So this is where we're seeing the most charges by payer, and then the percentage that were actually recovered after they're closed. So if I were to highlight here all of the payers that have a less than 10% recovery rate on our registration denials, you'll very quickly see now here on the right side, these are all of the payers that are registration related denials, and we can start to see the volume of denied charges, and I could very quickly summarize or total that, trying to understand the gap. If we could cut that rate in half, you can see fairly quickly there's fairly large numbers here. So that's just one example where not only can we use the analytics to identify and verify, but we can also then understand and quantify the gaps or opportunities, and of course communicate that, which we're going to talk about next. But Becky, are there more comments you'd like to share as far as revenue integrity and quantifying things?
I like the graph at the lower left-hand corner that has unresolved denied charges. That to me just speaks very quickly of, oh my gosh, how much money do I have sitting in unresolved denied charges? And it's a little deceptive there because the trend goes down over time. It looks like we don't have a lot of denials now, they're being resolved. What's actually happening is we haven't gotten those denials yet. It takes some time for them to come in. And so I think that gives a good picture of, in fact, how's our denial and appeal process working, and is it effective?
Excellent. So we have one other visualization, and we're going to look at an opportunity with Medicare annual wellness visits.
So I think annual visits for Medicare patients is a vastly untapped source of new revenues for physician practices. Nationally, only about 15% of Medicare patients actually come in for their annual wellness visits, and yet they are very important in order to establish the chronic conditions for patients. And I think there's still a lot of misunderstanding about what a wellness visit actually entails and why it's so important. But this dashboard does a good job of combining billing information and scheduling information to help us identify patients who have not been in, and we could also quantify the revenues associated with those visits. So Russell, why don't you walk through this dashboard just quickly?
Sure. This is a fairly simple design. We're looking at some of our divisions that would be focused on wellness visits. And you can see here on the right side of the screen, this column, this is their last wellness visit. We've then derived a column in our analytics to make it very easy to see, are they overdue for their next visit? And just by clicking a simple selector here, you can see now I can find all the patients who are overdue or haven't had them, because you also see patients that are overdue or showing up here at the blank. And then the other question, though, is we blended in scheduling data with when their last visit occurred, so we can see, do those patients have a future visit? Are they coming up shortly? And we can then filter and say, let's look for all the patients that are overdue, that don't have a next scheduled appointment, very quickly get out a patient list. But to go a little further, if our goal is to quantify the gaps or the opportunities, we can very quickly see, if you sort of look through these 4 or 5 physicians here, I could circle, highlight, total, and you can see that it's family practice where we have these 5 physicians might be the ones that we most want to focus in on, and those patients to the right of my screen here where we see some opportunities. So we're not only identifying where there's an opportunity, but we're then able to sort of communicate that, which leads us into our next topic as well.
Okay, so let's talk a little bit about communicating and taking action. Let's go to a dashboard that I think illustrates some of the communication goals here. So this is a dashboard that is laid out specifically with some benchmarks around NAHAM's access keys. So the access keys cover everything from collections to registration time, insurance verification rates, and you can see the rest of the metrics there. And they give you a good, better, best target for each of these areas. We've reflected that against the actual for this organization. And then the last two columns, you can quickly see, are they meeting the good targets? Are they meeting the better targets? And no one was meeting the best targets, so it doesn't show up there. But a very quick way, using very simple check marks and red X's to communicate which targets are we hitting and what's important to the organization.
What I like about this dashboard is people normally think dashboards when they communicate have to have a lot of color or bar charts or pie charts. And yet I think this is very effective to show we're doing a good job, but we're not doing above average, if you will. The other thing I want to point out is going back to that analytics structure is you'll see this view detail. So your dashboard, even if it's non-graphical, even if it's a static dashboard, can still be set up to drill right back into your analytics like you saw earlier. So effectively communicating, but then providing supporting information is also really useful. We have another dashboard around communicating, and this one looks at collections again, but it's really focused on copay. And Becky, why don't you walk us through this, how this could be used to help communicate or take action or articulate how are we performing against a problem we've identified or where there's a revenue integrity opportunity.
One of the things that we identified earlier in the revenue integrity dashboard was that we weren't doing a very good job of collecting copays. So what we've done is we have isolated that area and we've put some targets in place, again with our quick answers, setting some goals for our organization and tracking that using various metrics and showing it in graphical form. So calling out attention to a problem, giving our employees feedback on how are we doing. The minute you start paying attention to something, communicating about it, you will get improvement in the processes just because you're calling attention to it. So a detailed look at a problem area.
Excellent. You know, and again, what jumps right out at me in this visualization, you can see the green checks, red X's, but right in the center of the screen, how are we trending in the last 3 months of copays? And I encourage, when you're thinking about designing visualizations, traditionally everybody would run what I call the encyclopedia dashboard, got to show 12 or 13 months trended. But more and more today with mobile devices, people are looking for quick information at a glance. There's a reason why we call it a dashboard. And so to me, this really quickly shows how are we doing at point of service collections. It jumps right out. So I think this is a great example of a dashboard. Can you drill down a little further, Becky, though, with how your experience with communicating with leadership and identifying areas, but oftentimes it takes that executive level support to drive changes in the organization. So how using analytics and designing dashboards, how does that tie together?
Right, Russell, you have to have commitment from your executive team and your management team in order to get action. The dashboards themselves will not create action. The dashboards are great for summarizing data and presenting it, but it takes action from people to get changes to the organization. So the principles that I use are just really simple. I make sure that I am summarizing the data for my executives. They don't have a lot of time. They don't want to spend a lot of time understanding the issue. They want to see something in a graph presentation, not necessarily a graph, could be a chart, could be a simple 3-line sentence that's in very large type so that they can quickly grasp the concept. You need to provide context, give them a comparison. Here's why. Here's how we compare. Document the assumptions. Too often we make some assumptions when we're compiling data, and we don't document what those assumptions are, and they're very important for someone who is reading the document. Present findings. Very often I find that analysts will do a great job of summarizing the data, they'll present it well, but they don't tell us what we should do with it. Please put a summary in there of a recommendation. What should we do? How should we react? What's the appropriate outcome from this to make it easy for people to read the report or the dashboard? I know that's kind of not popular right now to put recommendations on dashboards, but I think it's very important that when you present information, you should have some type of recommendation to go with it.
So with that, Becky, I'd like to come back to the first visualization that I shared. And one of the technologies that we're using here, this is actually analytics visualization through MicroStrategy. they've added that very feature, the ability to comment in on dashboards, share comments with dashboards, and even save your perspective on the dashboard with other users. So I could comment in on this, make recommendation, and show you that we're seeing a problem with a particular division or group, and even then action items, right? But let's break down this dashboard a little further from an analytics perspective, because Becky, I think we go back to we've shared different ways through this webinar to look at data and use analytics around revenue integrity, but we put some unique design elements into this, and I showed it very briefly, but I'm not sure everybody might have picked up on it. So here you notice we have accounts receivable. We made the two subpanels underneath here also in that same red for accounts receivable. But as Becky, as you just shared, communicating, sort of making the key metrics that we're trying to focus the user on, focus leadership on, really loud right at the top. We've got 279,000 in credit balances, right? That's potentially a liability to the organization if we're not appropriately managing that. We've also added context to the AR so that if it's good, it's green. If it's sort of higher than we'd like to see, it's orange or red. And then in the next section, as we looked in details of denials, but this dashboard again was meant to focus the user on two key areas. What is our denial count and what is our denial percentage, right? And then you can also see denied charges and then how our recovery is on those denied charges here and here, as well as that we're still seeing through the organization that kind of registration challenge we saw earlier. And then the third area that we looked at was coding, and again, meant to show, and we're using the 99214 in the coding because it's easier than showing the whole range of level 1 to level 5 codes. But you also see, again, we do have those control ranges that we could look at. So this dashboard, it's fully interactive, but it does not only support kind of the three key areas that we talked about. How do we measure and verify the results, bring in our benchmarks, analyze and quantify the gaps and the opportunities, and then communicate effectively. And this may look fairly simplistic compared to some of the other dashboards we've showed, but it always goes back to who are we trying to move and what are we trying to share. So with that, the one thing that we haven't talked about in today's webinar is how do we get the data? How are you showing these capabilities? This is probably the number one question that I'm seeing non-technical people ask more and more of PDS, yet several years ago it was, I need help getting to this measurement or this result. And today people continue to ask the question, how do you get the data? And how do you get the data to be intelligent and present and easy for the end user, if it's revenue integrity or operations or finance or a department administrator or even down to a physician having the right information at their fingertips. And this is what we do here at PDS. We are experts in data modeling. We're experts in blending data. And so what you've seen is our capabilities and our resources pulling together to focus the user with intelligent data that works. So Becky, thank you so much for all your insights and sharing your experience with us.
You're welcome.
Thank you for joining us and have a wonderful day.